Help reduce mercury poisoning. Mercury is a chemical element that can be harvested from roasting a gem called cinnabar. Cinnabar can be found in places of volcanic activity. Different causes of mercury release are volcanic gases and the movement of Earth's crust, mining using mercury with gold and silver and other metals, industrial processes like working around mercury, and coal burning for heating, cooking, and power plants. Mercury can be introduced to the environment through many different ways of exposure. Mercury naturally forms inside of the sediment to where the sediment can shift and move, which will work its way into a water source. Other ways of exposure from mercury are from fossil fuel burning and waste incinerators, where the waste would run down into the water and contaminating the water and the sediment. Also, the vapors would enter the atmosphere and would then go through the water cycle, raining down back into more water sources or the rest of the environment. Once in the water, the mercury gets transformed by bacteria into an organic compound called methylmercury. The methylmercury and bacteria are eaten by smaller fish, who are then eaten by bigger fish, and it keeps bioaccumulating throughout the food chain, so then bigger fish that are older end up with a higher mercury content. Humans would then eat fish and other seafood, where we would then accumulate some of the mercury content. Most larger predatory fish have a higher mercury content, like sharks, swordfish, king mackerel, marlin, northern pike, and most commonly, fresh tuna. Healthier options of fish with lower mercury content include shrimp, salmon, catfish, squid, oysters, clams, scallops, and sardines. There are a lot of health risks related to getting mercury poisoning, especially in developing children and pregnant women. Most noticeable for its neurological effect, symptoms of mercury poisoning can be anxiety, depression, tremors, numbness of the hands, feet, or mouth, memory problems, mood swings, loss of coordination, muscle weakness, impaired speech or hearing, and a lot more. For women carrying children, methylmercury exposure can negatively affect infants in the womb as well as adversely affect their brain and nervous system. Pregnant women can still safely eat seafood as long as it has low mercury levels and is cooked properly. Some examples for pregnancy-safe seafood are salmon, shrimp, anchovies, oysters, scallops, squid, crab, and lobsters. Mercury is considered mostly safe. There is no cure for mercury poisoning, so the best form of treatment is to limit your exposure to the element. Healthcare professionals may suggest starting chelation therapy, which is an agent that binds to mercury and other toxins and exits the body through urination. Chelation therapy comes with its own risks and side effects, so it is crucial to use the medication only when your mercury levels reach a certain point. There are other attempts to reduce the amount of mercury in your body, such as dialysis, whole bowel irrigation, and transfusion. The best thing to do to reduce the intake of mercury, whether that be a change of diet or a change of work, and the stoppage and avoidance of products containing doses of mercury. Reducing the amount of mercury exposure is the only thing to do for preventative measures, while it's the lack of a cure to avoid long-term effects of neurotoxins. So far, we have learned that mercury is a naturally occurring element that is considered safe in small amounts, but is harmful and has extreme health risks that are neurological and have long-term, commonly permanent effects. Mostly caused by humans, mercury is exposed and released into the environment, affecting the water and soil, and it can be accumulated through ingestion of fish, inhalation, and direct dermal contact. The weekly limit of mercury intake should be 3.3 micrograms to every kilogram of a person's body weight. Mercury poisoning can be diagnosed by a chest radiograph, urinalysis, and blood tests, while as there is no cure for mercury poisoning. Everyone is exposed to mercury in small amounts, which is not harmful and why it's considered safe. But caution should be taken to reduce the amount of mercury exposure and prevent mercury poisoning. Thank you for watching, and I hope you found this informative. Please like and subscribe, and if you would like more information, check the video description.